Yes, I'm Dr. Layoo Alex Celestino. I'm a senior medical officer. I have been in medical profession for 20 years now. I started as a young officer, as a clinical officer from Bali. I qualified in 1992. Then I worked in Kitgum Government Hospital for 5 years as a clinical officer, and I got a chance to do the interview, and I succeeded in joining Makerere University, where I successfully studied for 5 years, and I got a bachelor degree of medicine and surgery of Makerere University. The war, LRA was very serious. Many people were being injured. The army, the rebels, the Wananchi, the civilian were being injured, and I was alone in the hospital. However, we competently managed the situation, the casualties, and succeeded in reducing the death rate of the injured people. I had to undergo some short training in war surgery, and as a result of that, we were able to really handle the condition very seriously and effectively in the hospital. Only few cases were being referred. Now, when the LRA came to apparent end, we saw there was need for people to return the pre-war homesteads. The government had in place arrangement to return people to their pre-war homesteads, but it was not sufficient. For example, the health sector was not coping up with the rate of return. I therefore thought of opening a health center in the Patong Trading Center. Patong is actually 13 miles from where I'm talking now, on the western side. I thought of opening a center which would provide services, which would include surgical services, reproductive health services, clinical medicine, immunizations, HIV/AIDS services, in brief, which could offer integrated services to our community. This is a community who are from the camps. They are going back home. They are very poor. They have no money. They cannot access quality medical care, and yet they have the right to access. But because of the situation, their right cannot be met. So I thought, I developed an idea of opening a health center and possibly gradually developing it to meet the objectives of offering these integrated critical services to our people. At the moment, the fund for building the structures, which is, although not yet completed, I got from my salary and part of it from the loan, which has taken now almost 10 years. We have a 20 rooms building. Currently 4 rooms are already completed, and we have started working on the 4 rooms with the aim of generating fund and looking for more fund to complete the building. What we have witnessed currently is the high demand of service, medical care the community have. All the lower health units now refer their patients to the health center. And all people all over the surrounding districts. We are in Agago district right now, but we are receiving patients from Abim district in Karamoja, from Kotido district in Karamoja, from Lira district, from part of Gulu, from Pade districts. We are receiving complicated cases being referred to this health unit. And the ones we cannot manage from there because of limitation of equipment, we have to provide some transport to rush them to the other hospitals where those services can be afforded. So, the few durations care that we started giving has given me a lot of observations. People really need a lot of services, but at the moment we are still limited. If we could get a means of making sure that the building is completed and we get some fund which could keep us a little bit moving, taking care of the currently I've employed one comprehensive nurse. Comprehensive nurse is somebody who has done nursing and clinical disciplines. So it's doing both nursing and clinical practices. I have one nursing assistant. This one who has done training in nursing, short course in nursing for 1 year. I have one laboratory assistant, and I'm looking for another one enrolled comprehensive nurse and maybe a clinical officer. Now, I have the feeling that if I could get some support, so that for the first 3 years, the salaries of these workers don't come from the little money the patients are paying. As I said before, this is a very poor community. They've just come from the camp. They've lost a lot of things. They cannot generate income to meet the high costs of medical care. So the person will be paying subsidized rates. Meanwhile, the salary could, if I could get someone to pay the salary for 3 years. By the end of the third year, I believe that the health center would have accumulated some fund, which could be now to give enough push. Okay, the start off, to give an effective start off, where we shall be able to carry out all these 5 integrated services. So this is really what I'm saying. But all in all, I can see that this health center is giving a lot of support to our people. If I take, for example, let's look at surgical care. Surgical care from Patong, where the health center is, to the east, you go up to a beam hospital, and a beam hospital is 26 miles. 26 miles when you convert to centimeters, it's about 42 kilometers. Right, kilometers. That is to the east. To the west is up to Bulu, over 160 miles. To the northeast is Kitgum, Government, and then Lira to the south. Now you'll find that of all these hospitals, it's only Kitgum, which is very far away, which is offering free treatment. The others like Alongo, like Cho, maybe Tampara and so on, Bulu Referral, all these are paid. The patients have to pay for, which our majority of people cannot afford. That's why I'm thinking if I could have a health center that could subsidize, could offer medical services at subsidized rates, it could go a long way stepping up the healthcare in this place. Last but not least, currently we have moved to elimination of mother to child, the transmission of HIV/AIDS. HIV/AIDS, as you know, in Uganda, we have been battling HIV/AIDS. Sometime a long way we managed to reduce the frequency, the incidence to almost 6%, but now it is on the rise. And we still have some children being born with the virus. Now, we have Uganda, WHO and Uganda, and Ministry of Health of Uganda have adopted a policy of elimination of mother-to-child transmission. We expect by the end of 2015, no child in Uganda must be delivered with the virus. We have the program called Option B+, which is very effective. It is tested, it is effective, it is tested in Uganda here, where 100 mothers were put on the program, the mothers who are infected but pregnant, put on the program. All these delivered 100 babies HIV-free, and other places. The other day we were in Lira, the USA, the representative of USA ambassador told us that in the state, about 1 million children who are enrolled on Option B+, 1 million children in the state are born without HIV. So this is a clear indication that HIV can be eliminated. We may have a new generation without the virus. And if the preventive measure is effective, most likely we shall have a generation without the virus. Now, this health center will go a long way implementing these activities, making sure that our community is sensitized, making sure that the community is sensitized, the community get access, it is within easy reach, it is acceptable, okay? It will be affordable to the community, and all this will make it really very effective. So my holy appeal and hope is that whoever is outside there who can help, please come. Let your effort also reach the people. And this health center will make your plan and your effort reach the needy people. May God bless all the viewers. Thank you.